Hi guys, I'm back at the hospital again. So today I have to have some blood work done and I have another appointment, and I'm assuming that that appointment is with my oncologist to go over the results of my bone scan and the CT scan. So I'm pretty sure that everything's going to be positive. I'm hoping it's going to be positive. Look, I want to show you guys them pretty dahlias again. So anyway, I had a phone call from the hospital the other day, and they want me to do some physio, and the physio is when they extracted the lymph nodes. So they took 4 lymph nodes out, and one of them had that cancerous growth on it. So I'm half expecting that the oncologist is going to tell me today that some of my other nodes have been found to be suspect to have cancer in them. Like, that is like, I'm totally okay with that. Like, to know whether it's spread into any other organs, that would be like really devastating. So obviously I'm not going to worry about that because I'm just going to stay positive. And also, so anyway, when I lift my arm up, it's kind of like really tender. So it's kind of like just like stiff. That's all I can say. It's just stiff. So the physio are obviously going to help me sort that issue out. So I'm really early, and I'm glad that I got here quite early because the car park was starting to fill up. So my appointment is at 9 o'clock and it is currently like 8:05 or something like that. So I'll probably go in about 8:30 because I've got to do my pre-screening for like the you know what, to make sure I haven't got like a cold or anything like that. And also I have to go to reception, and sometimes that can actually get a real long line. And then after that I go and get my blood work done, and then like I said, I don't know what this illusional of appointment is. The funny thing is that they put you in for these appointments and you actually don't know like what each of the appointments are. It doesn't actually say oncologist on it. It says like something else on it, like outpatient or something like that. I mean, I'm not having an operation or anything today. Well, I hope not. But yeah, I'm pretty positive, happy, go lucky. I look fabulous today, by the way. I've got my like white shorts on, my blue top, and my gorgeous headscarf. I love this headscarf. Sorry, I'm kind of like loving on myself right now. If that's the right face. Anyway, so let's see how much I can film of this, because hopefully I want to be filming the oncologist telling me stuff, so you and me know exactly what the deal is at the same time. So I'm going to try and film that. Obviously I can't film her. I'll just keep it on my face. So anyway, let's see how it goes. So I'm just like looking into space. And slurred speech.
Because you were so tired?
I have no idea, it was so weird.
How
so
long
like,
was the slurred speech for?
Not like, so most of my symptoms lasted for about 5 days max, and then after the 5 days I was back to normal again. So I think the slurred speech started around about like, so I was fine on the day of chemo. The next day, like apart from the slight dizziness, and then the next day I think I was still okay because I had the immunity booster. So I had that done the next day, and then it started to kick in. Okay. So on day like, I want to say 3-4 was the worst.
For symptoms overall?
Yes, the fatigue definitely.
Okay, and the slurred speech as well?
Yes, so that obviously came back. But people talking to me were the kind of like, you knew there was something like up. Like not being able to find a word. I can't even...
Like word finding.
Yeah.
Yeah, so it sounds like maybe a bit of chemo brain. Have you heard of that?
I have heard of chemo brain.
Yeah. Yeah, it's a real thing. So it can cause like impaired thinking, recall, memory.
Yeah, and I can't concentrate. I'm a sewer. I love to sew. Yeah. And I can't concentrate to sew. I can't concentrate to play a game.
Very common.
Like, it's weird.
Yeah.
You just want to just sit there and just like, and then I would like cry and like laugh because I felt so pathetic.
No, you're not. Maybe you're deliriously tired.
It was so, and it's like I wanted to get up and clean my house. I wanted to get up and like do my ironing and
but
stuff. But
you also need to rest a little bit too.
And this is what I was going to ask you as well. Like, what is the best thing to do? Is it better to rest?
I want you to do a little bit of both, honestly. So the best way to manage and help fight fatigue is to stay active. So it's staying active that helps to fight that. So if you are up to like going for walks,
yeah, during them first 4 days, we went out for walks. So I went out for at least a 15-minute walk. Well, the problem was is that I didn't trust myself to go alone because I was so like you reach action time when you're walking, and like I was like, oh, if I cross the road,
But like honestly, that's good. If you have
not
somebody
getting
to go
knocked
walking
over.
with, but if you have somebody to go walking with, that's great.
Yes.
So making sure that you are at least getting out of the house once a day.
And it was so hot that first treatment. So like with the temperature like dipping, it's so much easier. But it was like I was in like it was 30-degree weather when I had my first like 3 weeks ago. So it was kind of tough to go out.
And then if you feel like doing housework, awesome. But if you need to rest for those like first 4 days, that's okay too.
And it is just the first 4 days, isn't it? Or does it get worse after every single treatment?
Typically, yes. Your symptoms can get a little bit more intense as treatment goes on. However, everybody is a little bit different as well. But typically that is what we see. The longer that you're on treatment, the more intense your side effects can be.
So I'm on a course of 6 treatments. So they're going to do the first 3.
Because you're on number 2, right?
I'm on number 2. And I'm getting a bit anxious about the switcheroo of the other one. Because like I'm used to this one. It's like, can we not just stay with this one, please?
No. I know. That's how the protocol works technically. But yeah, it will switch up on you. So just honestly, my best advice to you is take it day by day, especially in those first 4 days. If you're feeling extremely tired, it's totally fine to just kick your feet up, watch some TV, relax. Try your best not to nap for long periods throughout the day, of course, because that can mess up your entire circadian rhythm and sleep schedule. But when you are feeling up to it, go for a walk. Even walk around your house. Do something, do a batch of laundry if you're up for it, things like that, just to help stay active. Okay. But otherwise, it sounds like you handled your first treatment quite well.
I did. I'm trying to be positive about it. I've had my days and my moments. Like just on it was Tuesday. I had to shave my hair because my hair started falling out and stuff. So that's been a bit. That's why I marked 1 on the anxiety and depression, just because I just feel really sad about that right now.
Yeah.
But I'm getting a lot of support and positive comments and stuff. So yeah.
I'm sure you're rocking it.
I am trying to.
But yeah, we're so attached to our hair, hey?
I don't know. I think women define themselves with their hair for some weird reason.
Yeah, and lots of women have difficulties, the most difficulties when they do lose their hair because it's a part of their identity, right?
Yeah.
Yeah.
And I've been informed that it does come back thicker. And
it does come back.
It may even come back a different colour. Like,
or wavy. Curls are a thing.
Yeah.
Yeah, and it's just temporary, right?
Okay.
Keep telling yourself it's just temporary because it will come back.
I know, because it could be worse. I haven't got a bad diagnosis. So I just need to just remind myself, because there's a lot of women that are going through worse than me right now.
But you're also going through a lot too, so don't forget that.
Yes.
Could you remind me? Don't minimize your journey, right?
I'm trying not to.
You're still going through a hell of a lot.
Yes.
You got this.
So could you remind me what type of cancer it was or is?
Susan can come in and she'll tell you all of that. You're going to see our nurse practitioner today. Okay. Have you met Susan yet?
No, I haven't.
No, she's lovely.
Because I have is it Jewel? I can't remember.
Dr. Chris Hiller?
Oncologist it is. Oh, it's in here. It's in my book.
Your lovely book.
Judith is my
oncologist.
Yes.
Yes. So what happens is we do also have nurse practitioners if you are stable throughout your treatment that you see. Sometimes they'll come in and if everything's going well, you'll only see a registered nurse. So today you're going to see Susan. So I'm going to send her on in, let her know how you're doing.
So also the mouth sores. Does that like I don't know, I didn't have them. Does that mean I won't get them? Or?
Not necessarily. Like I said, every cycle is different. If it didn't affect you this cycle, you may get mouth sores in the upcoming cycles.
Okay.
But the best you can do is just to do preventative mouth care, so making sure that your mouth stays nice and clean. A lot of people like to rinse with club soda.
Yes.
Because it helps to break up some of the debris in your mouth. If you are finding that your mouth is starting to get sore, because a lot of the times people's gums will get sore before they actually get open sores. Just making sure you're rinsing. In some of the booklets that we gave you when you were first in, yeah, they go through like baking soda rinses. Those help people as well.
Yes.
So if it does get to the point where your mouth's getting sore, I'd just start doing that as routine.
And keeping hydrated, is that another tip as well? So making sure that you're drinking just loads and loads and loads.
Yeah. Make sure you're drinking lots of water. At least I would say minimum like 2.5 liters.
Yes, yeah, I'm drinking loads of water.
Okay, good.
Yeah.
Awesome. Okay, I'm gonna let Susan know here.
Hi.
I'll send her on there to chat with you.
Thank you.
No problem. How are you?
I'm good.
I'm a new person for you. I am Susan. I am your nurse practitioner.
I'm pleased to meet you.
It's lovely to meet you. What is new and exciting? You've gone through your first cycle.
Yes, I have.
Was it what you expected?
Oh, everything and more. Thank you.
Oh, I'm so sorry. You know, it's always hard. We send people, we tell them all kinds of things. We send them to the chemo teaching class. You get overwhelmed with all these things that could happen.
Well, the chemo teaching class was a little bit overwhelming, I'll be honest with you, because I felt like I came away like I was some sort of toxic liability.
Yeah. You're not, but...
My husband's there like, yeah, I'm not touching you now. I was joking.
Yeah.
But yeah, so is this, the point of this appointment is my wellness and mental health, correct?
The point of this, every time that you have chemotherapy, we check your blood work to make sure that your immune system is recovered, you're able to fight off infection, that your liver is working appropriately to get rid of the chemo. We talk about the side effects of chemo to make sure that they're manageable.
Okay.
And that you're coping.
Yes.
So all of those things are important to us.
Okay.
Your physical well-being, your mental well-being, it's all part and parcel.
Awesome.
So, you know, sometimes you're on a protocol that I consider to be particularly pukey because there's lots of nausea and vomiting in the first 3 cycles of this.
So this first cycle, I didn't have any nausea. Is that normal?
That's lovely. No, it's because we're using good drugs for you.
Oh, thank you.
Sometimes people are particularly sensitive and they need extra drugs added.
So one thing that I am doing to help everything is I'm eating a lot of like iron-rich foods.
Excellent.
So I'm eating amphetamine. So I'm eating like all bran, and I'm eating so when I do my first course of chemotherapy, I'm eating like meatloaf with liver inside of it. You're gonna say I'm crazy. Are you so crazy?
No.
You're like, I couldn't do that.
No, it's good. Like I have a patient whose hemoglobin, her red blood cells were low. She needed more iron. She ended up having oysters every morning for breakfast.
Oh, right, I couldn't do that.
It
I couldn't do
works
oysters.
for her.
So
right?
I also do sardines with lentils.
Perfect.
And butter, and so I'm having like, and then so along with the iron foods that I'm eating a load of B12 foods. So that's supposed to help with the absorption of the iron in your body and make it even better, kind of like boost it.
Perfect.
Yes.
Your blood work, when we do your blood work, we do 2 different things.
Okay.
We look at your immune system, your ability to fight off infection.
Yes.
And we look at your metabolism. That's the function of your liver and your kidneys.
Okay.
That metabolism blood work always takes longer.
Okay.
I don't have it back yet.
Darn it.
I will. I just don't have it
I'm
back
trying to
yet.
get like a 5-star here, yeah?
Well, so far you're batting aces because the first half, your immune blood work is perfectly normal.
Brilliant.
Like I wouldn't be able to tell that you're on chemotherapy by looking at.
Is that normal? Is that good?
That's perfect.
Thank you.
That's exactly what I want to have. Because over time, yes, we may wear you down, and you may find that symptoms feel a little bit more bothersome.
Okay.
But you have recovered stellarly well for your first cycle.
More than usual? Like
Perfectly. You're exactly what I would want. This is what I want. This is my goal
Thank
for
you.
everyone.
Awesome.
So, I guess my question for you is, what was the hardest for you? Like, how can I help you?
Well, it's the fatigue, and there's nothing you can do for that. So,
well, I can encourage you to still be active, because although you're tired.
So the funny thing is like after the first 5 days. So it was good after the first 5 days. So
Yeah.
like the next treatment, that's my goal. I want it to be better. I want it to be quicker than the first 5. I want it to knock down to 4 if I can. And about the second week, I had all this energy, which was really weird. I was like, I couldn't sleep, so I had to get up. And I was at 1 a.m, I was cleaning my pantry out, my fridge out, my freezer out, my downstairs. All my downstairs was spotless. I had all this energy, and I don't know where it came from.
I'm not sure if you can tell I'm smiling. It's not the first time I've heard that.
Oh, really?
I've had a person who vacuums at 2:30 in the morning because she's like, I'm awake, I might as well.
Because I'm laying there and I'm thinking, I can't sleep and I can't sleep and I can't sleep. I'm like, well, what's the point in lying here? And then like, my husband woke up in the morning and he was like, you did what?
Yeah. So has sleeping gotten back to normal now?
Yes.
Okay.
Yes.
So just to kind of encourage you, if that happened a lot where you're not sleeping and you're starting to feel that that's affecting you, do let us know. Like, I can give you a medication that's a sleep aid.
Okay.
Because it's okay if you maybe have a night or two where you're...
It was just one night.
Okay. But if it happened more and you're not sleeping and then you're feeling draggy for days, we want to get your sleep patterns to be normal.
Yes.
Right? So just to know that there are options that we have.
Yes.
Okay. I'm going to guess that you're at peak hair loss right now.
Do you want me to show you?
Are you losing it? Okay.
So I went to the hairdresser and I shaved it off.
Yeah.
Because what was happening is that I was pulling it out and it was coming out in just like
big clumps.
Chunks.
Yeah.
Like there was like 15, 20 chunks of hair coming out. So she shaved it all down, but as you can see, it's like it's balding, it's going.
Yeah.
And it was irritating me as well because you could feel like a burning sensation on the back of your head.
Yeah.
I can still even feel it now actually.
Yeah.
But I mean, it is what it is.
Yeah.
Like,
so using a dry face cloth to kind of massage your head will probably help make a lot more of that fall out, the short stuff.
Are you saying to encourage it just to go?
Yeah, if it's loose and irritating, sometimes people will just take a little cloth and see what happens.
Yeah.
The other thing that one of my patients has told me that she used was a lint brush.
Oh, really? Oh, that's too funny.
And for her, it worked really well because the little tiny pieces of hair are so sticky.
Yes.
Right? And they're irritating. So
I kind of like went for a shortcut like you've got.
Yeah.
And then, because it was quite long, it was like right down here. And I thought, well, I need to like deal with it.
Yeah.
And then like, just like Tuesday, it went. So I'm still kind of traumatized by it.
Yeah.
Yeah, I'm not going to cry over it because there's no point. I'm sick of crying now. I've cried for the last 2 days. It's done. I've got like 7 wigs. I've got loads of hair scarves. I've got baseball caps. I'm like, seriously. I had to walk around the mall the other day because I was there like, everyone's going to stare at me. Everyone's going to stare at me. Not one person stared at me. Like, nobody's bothered.
And the truth is, most people are so selfish and so self-absorbed. They don't notice or care about anybody else. And it's a sad indictment in this world to say it.
But that's what I need to remember.
Yeah.
Like, nobody's bothered about me. Like, just get on with your day.
Yeah.
It's like it took up so much courage yesterday just to go outside and water my grass. Because like my neighbours were outside.
Yeah.
And I was like so bothered about that. And I was like, no, I'm going to go outside. I'm not wearing a base. I'm just going to go out like this. Well, probably I shouldn't have done. Because like the sun.
Yeah. And the sun is not your friend.
You're going to smack me in a minute. You did what?
Well, you know, I find people discover things the hard way.
Yes. Yes.
So.
Yeah, I don't want sunburn on my baby head.
Yeah, it hasn't seen the sun in a long time.
No, it hasn't. Yeah, I've got to be careful. But yeah, I've got mechanisms. But I was saying to my husband, like, I don't want to start putting my wigs on and headscarves on and hiding behind it and almost being too scared of like what is the reality.
Yeah.
Because I think you have to cope with that as well.
Yeah. No, that's very true. That's very true.
And I don't want to be like just. Oh, like, because before it was like, I was putting the wigs on because it was kind of fun. It was like, oh, I've got pink hair, I've got purple hair, I've got, like, blonde hair and this, that, and the other. And, like, now because I don't have the backup of my real hair, it's there, like, okay, I don't want to, like, start putting them on because I'm hiding. Yeah. And I'm scared because I need to go out and be who this is now.
Well, and you as a person are the same ray of sunshine you have always been. And your hair has been an accessory to that beauty of your internal spirit.
That's so true.
Right?
Are you going to make me cry now?
No, I'm not.
Don't.
So my sister, when she's a musician, she got her hair permed in 1978 in Toronto, and they burned her hair off.
Oh.
So she's a musician and she has no hair. So she has got the greatest selection of wigs ever because she says it's so easy.
Yes.
It's so easy. Her hair never came back normally.
Oh, wow.
But she's got lots of wigs. So lots of people can use and wear wigs.
Yeah.
So I have many patients who have told me, you know, it helped me to cope when I needed to.
Exactly. And then when you feel like you just want to walk out bald, then you can.
Yeah.
You know, it's like, it's having the backup. And I got the backup beforehand. I got it before I lost the hair. Because at first I felt, it's like, I feel so weird walking out in a wig. Is that like, well, I've got no bloody choice now. Like,
Yeah. Well, you always have choice, but
yes.
And the good thing is your scalp, your head doesn't look like it's a bad shape.
Everyone keeps saying that to me. Will you stop it?
No, my husband's got a big dent in his skull. Somebody threw a brick at him when he was a kid.
Oh my god.
So I mean, your scalp.
Yeah.
That's good.
Thank you. I'm getting a lot of support.
That's good. We want you to have support. This is not easy stuff. We are here to help you get through this.
Can you remind me again what kind of cancer it is or was or whatever
Yep.
that I had?
Yeah, let me grab your chart.
Yes.
I'm going to go quickly look and see if the rest of the blood work is back.
Oh,
Because it might be back by now.
ka-ching.
So hang tight.
Okay.
Means I have to hit about 6 buttons on the computer, so I'll be right back.
1 out of 4 lymph nodes. So have they found any more cancer in any of the other lymph nodes?
So you had 2 other scans that were done.
The CT scan and the bone scan. Now I'm assuming that the bone scan is all clear, apart from the stupid arm situation.
Why is your arm stupid?
Because I don't know.
Okay.
But anyway, it's 10 stop. So they
Okay.
told me that I have to go to Physio for that.
Yeah.
So
there's nothing weird in the bone.
Okay.
Anywhere in your body. The bone scan is all clear.
Brilliant. So that's brilliant.
That's brilliant. When we look at the CT scan, so they did a CT scan of your chest,
Yes.
abdomen, and pelvis.
Yes.
So we are doing this as part of our staging to make
Yes.
sure that there's nothing nasty or worrisome. Going from the top down, thyroid is normal.
Oh, I thought I had thyroid problems.
No. We look at everything. We look at everything from here down.
Because I was on thyroid tablets. They found something in my blood from
Visualized thyroid gland looks normal. No swollen lymph nodes around here. No pulmonary nodes. No infusions or fluid in your lung. Your heart looks normal. No fluid around the heart. Chest wall looks normal. Post-surgical with segmental resection. Some mild thickening of the skin over the left breast. Nothing that looks concerning to them. They can see that you had a left axillary dissection. There's a little bit of fluid in there, but no.
So is that what's causing the tightness?
Probably, yeah. Your liver looks like there is what we call a low attenuation lesion, which could be like a hemangioma, just a blood-filled lesion, not necessarily cancer. Many of people, if we were to do a scan, would have some abnormality or a cyst or hemangioma in their liver.
So nothing to worry about.
Nothing that we see that looks worrisome. What they have suggested is that we should follow up on it.
Okay.
Because it doesn't look suspicious on CT scan, and they have suggested that we do an MRI to better look at it.
Okay.
MRIs are very good at looking at soft tissues,
Yes.
like our livers. So they have suggested that we do that, so I will set up an appointment for that.
Okay. Yeah, whatever. It is what
But
it is.
there's nothing that they see in here that looks like cancer.
So are you telling me that only the one node?
So when we
Are you telling me I was that lucky? Just the one?
That's what it looks like. Now I'm going to see if my computer here is going to work.
It doesn't make sense though, because like you have like
Oh,
40 nodes.
Yeah, I see this all the time.
So it literally just went into one and then that was just it.
Yep.
So right now the chemotherapy is just preventative to stop it from coming.
Yes.
I can't just walk out of here and say, right, and I'm not doing any more chemo.
Well, you certainly always have the choice to say that.
Yeah.
There is no evidence that you currently have cancer.
Okay.
It looks like we've removed everything that we possibly can at the time of surgery. There's no sign of anything left behind. Is there something in your liver that we would like to have a better look at? Yes, that's what the MRI is going to do. But there is no sign that we can see with our scans of cancer.
Okay. Just the one.
Yep. Just the one.
So he was like, how was he able to know that that one was the one?
So when you had your surgery, do you remember them giving you an injection?
Yes.
So what that injection is...
It was like a radiation thing, so they could tell.
It was a dye or a marker.
Yes.
That gets pulled up in the circulation around the area of your tumor. So we know that in the area around where the tumor is, if there are cells that are trying to escape, they will go into our lymphatic system and get caught in our lymph nodes.
Okay.
So it identifies where the lymph nodes are so that we can track them and remove them.
So he knew just by looking at it that that was a possible one.
They took out, well, they've written over it here. It looks to me like 4.
Yes.
And so they took out 4 that were identified as being primary circulation, and only one of them had disease in it, which was 18 millimeters. And that was it. No further spread that we can see anywhere.
Wow. I just feel lucky.
It is a good news situation, right?
Yeah. Sorry.
No, don't be sorry. Don't be sorry. These questions are hard, and often in that first meeting when you're talking with the oncologist, there's so much information. It's sometimes hard to remember or to take it all in. So asking the questions another time is awesome.
Yeah. Okay. So the liver thing is nothing serious to worry about. They just want to preventative, what could it be? Like, what's the worst scenario?
Well, worst scenario would be if it was cancer.
Okay.
But it doesn't look like cancer.
Okay.
But the CT scan doesn't take a good picture.
Okay.
So the MRI takes a much better picture.
Yeah.
And it will help us to know, is this a collection of blood? Is this a cyst? Is this just an abnormal blob of tissue? Which happen all the time.
Okay.
And if it looks like cancer, then the MRI will say, this looks concerning.
Okay.
And then we'll figure out where we go from there.
Yes.
But at present, there's nothing that's like a red flag saying, this is bad news.
Yes.
There is nothing that looks like that.
Okay, awesome. I'll keep positive. So the point of the chemo is, she told me that it was if I decided not to have chemotherapy, that it would be like a 47% chance of it may come back, and to have the chemotherapy would reduce that down to like 27%.
Yes.
And that's what we're doing here.
That's what we're doing.
Okay.
We are like, this is like the little insurance policy, reducing your risk.
Yes. Now my assumption is if they decide to do radiation, that's going to bring it down even more, correct?
Yes.
Okay.
And what the radiation does,
it just seems so weird to go through chemotherapy knowing that I don't actually have anything. Do you know what I mean? So it kind of confuses my brain.
Well, think of it this way. We've done the scans to look for abnormalities, but our scans are not enough to see a single cell.
Yes.
And when we give you chemotherapy, it goes everywhere in your body.
Yes.
And destroys rapidly growing cells like cancers.
Yes.
So even if we can't see it with our scans, or certainly with the naked eye, that if you had tiny, what we call micrometastatic, or 1 or 2 cell clusters, the chemotherapy can destroy that.
Yeah, so it's like a weed killer. Do you know, I laughed at that analogy for the longest time, but now it does make sense.
Yeah.
Because it's not like, well, it kills your cells, but then they all bounce back again.
Yeah.
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 Okay, so what kind of cancer was it?
So
I can never remember.
What you have, so I'm going to explain where it is so you'll remember better, okay? When you think about your breast, did you breastfeed?
No, I have no children.
Okay, so when we think about our breast structure, our breast on the inside looks kind of like grapes.
Okay.
The grape itself is the lobule of the breast where milk is produced.
Okay.
And the stem is the duct that the milk travels down.
Okay.
Your cancer started in the duct, so we call it a ductal carcinoma.
Okay.
And we can tell that by looking at its structure under the microscope and say, oh, that comes from the duct.
Yes.
It's the most common type of breast cancer that we deal with. I used to say it's my bread and butter, but that sounds really morbid. So I'll just say 90% of breast cancers arise in this part of the breast. It's a very common location. So we're very used to dealing with this type of cancer. It's
now,
not
does
rare.
that morph into a different type of cancer, or is it's always that type?
It's always that type. It's always, because you got to remember, we've chunked this out. It's gone.
Yes.
Right? It's not inside of you, as far as we know.
Yes.
So you had an invasive ductal carcinoma of the breast.
Okay.
When we look at it, it was 3 centimeters
Yes.
in size. It was what we call a grade 2, which means it was growing likely a little more rapidly than your normal cells,
Okay.
but not particularly aggressive.
Okay.
It wasn't like a high risk. It was just a little bit more quickly than your normal cells. 1 lymph node involved. They did see signs that this was trying to move into your circulation. We call that lymphovascular invasion. So they did see signs of that. And they look specifically at what helped this cancer to grow when we look at some of its hormonal markers. So you were positive for estrogen and progesterone, meaning your normal hormones helped this cancer stay alive.
Okay.
So at the end of the day, when we're finished with all the chemo and you're having radiation, you and I are going to have a lovely long chat about your options for oral medications to again reduce your risk of cancer recurrence.
Gotcha.
In addition to the benefit of chemo, there's an additional benefit for oral medications.
Yes.
So, common type of breast cancer arose in the duct. We call it invasive ductal. Involved 1 lymph node out of 4. This puts you in a position where we're able to treat you with the intent for cure. Make this go away.
Okay.
Make sense?
Yes, it does.
While I was out there, I've got most of your chemistry back. Not all of it. Your liver is very happy.
Oh, it
completely
is?
normal. The only thing that I was missing is the marker for how well your kidneys are working wasn't quite done yet.
So can you tell about so is it the red blood cells or the white blood cells? Which little guys do I need to help?
You need all
Boost.
of them.
All
So the
of
needle, you're getting the needle the day after chemo,
Yes.
that is helping your white blood cells.
Okay.
And your
Because I was told way back when that I had a low white blood cell count or something. I can't remember if it was a low white or low red. Does that even show up on any of my tests?
oh yeah. So your hemoglobin, that's your red blood cells. You're normal.
Okay.
You're normal.
I'm normal. I don't want to be normal. No, I'm just
sorry.
joking. Yeah.
Your red blood cells also normal.
So
Your
my red blood cells are normal and my...
white blood cells are normal.
Okay.
And your platelets are normal.
What are your platelets?
Those are the tiny little blood cells that are used to help heal from bruises and cuts. They help
That's
you
funny
make a
you
clot.
say that. I'm always walking into stuff and bruising myself.
Yeah, so platelets are responsible for helping to heal those.
Okay.
They make the clot and the scab so that you stop bleeding.
Okay. Okay.
Normal.
Everything's normal. Awesome.
So you've got what I describe as a terrible advantage. You're young. You're healthy.
Yes.
So going into this, you, by the very nature of how sturdy you are health-wise, will do much better than some of my other ladies who are older and more medically fragile.
Yes.
So you have a terrible advantage.
Yes.
But I'll take it.
Yes.
It's absolutely awesome that you have that because you will get through this hopefully much better.
So my message to everybody out there is to get your mammograms and your ultrasounds early.
Yeah, absolutely. I'm just going to quickly look and see if I can get in and look at your kidney results while we're together.
Okay.
Is this all making sense to you?
It is all making sense, yeah.
Now, when people are on curative chemotherapy, what happens is that for the most part, your oncologist will send you to me. I work with 10 different medical oncologists, and my entire world is taking care of women like you.
Okay. So I'm not going to see Judith again, basically. I'm seeing you. Okay.
The only reason you would see me is if I'm going on holidays, but I just came home from Nova Scotia, so I'm not going to go anywhere for a while.
Good. I get attached to people.
But me too. It's so much easier to help people when you actually know them. So sometimes you might see Judith if there was a problem, if I was away, if there was something like that. But most of the time, you're just going to see me from now on.
So my question is to you is like, what can I do better? Like, so eat how I'm eating, like, well, and like drink loads of water.
Yeah.
Stay positive
and be a little physically active.
Yes.
Good.
Yes.
Yeah. So we're still just waiting on the creatinine blood work. It's probably just tied up on one of the machines that they're doing it, but everything else is completely normal. Your liver is happy.
Yeah.
It's doing its job.
Okay.
Which is to break down the chemotherapy and help you get rid of it.
So do you know when the MRI is going to be booked for?
So no, I have to send off the request for that now.
Okay.
So they will give you a phone call.
Okie dokie.
And I'll try not to do it like the day after chemo when you might not be feeling the greatest.
Well, that was too funny because the woman who phoned me for like physiotherapy was asking me to call on the Monday, and I'm having done it like this. I'm having it tomorrow. So then I'm like, no, I can't do Monday. Week after, thank you.
Yeah, no, that makes sense. So I will make sure that I ask for it at least a week after so that you're feeling
So this is
reasonable.
good stuff. So I'm going to see you every time. So the day before I have my chemo, I'm coming to see you.
Yeah, and I have 4 clinics. So if, for some reason we had to move you a day or so, I have lots of openings to be able to see you.
Okay, awesome.
Okay.
Oh, a question is, like, I know this is so far in advance, but, like, when this is all dealt with, like, what happens?
Yeah. So we've got a couple of options.
I mean, like, if preventative, like, do I get to have, like, an ultrasound? Like, because I'm panicking now, like, it's like, I don't want to just, like, this is all over and done with, and then it's like, what happens if it comes back?
Yeah. And that is a very normal and human response to being in the middle of this.
Yes.
Okay. So we're going to talk about ongoing follow-up and monitoring once the chemotherapy is all done and once the radiation is done. Prior to your radiation, they're going to do another scan of the area where you have your surgery that will help them do the planning for the radiation.
Yeah.
After the radiation, they're going to do a mammogram plus or minus an ultrasound at that time to evaluate that, and after that it'll be once a year.
Okay.
With the MRI that we're doing, if that shows up something that's weird, we might say, let's check it again in another 6 months or a year, or we may say, no, we completely know what that is. We don't need to image that again.
But then what happens if we're focusing so much on the breast that it pops up somewhere? Do you know what I mean?
Yeah, I do.
And that scares me.
Yeah, absolutely. But what we see is that with good, thorough follow-up with your family doctor, regular physical exams, and regular imaging of the breast area, this is the greatest risk spot where you had your surgery. So we focus.
No, but you're worrying me about my bloody liver now.
But we're doing the best imaging to take a look at it.
Yes.
Right? So I am not terribly concerned about it because it doesn't look on the CT scan typical for cancer.
Yes.
And we'll have much better imaging with the MRI.
Yes.
So I think we still treat this with the benefit of doubt, and we say, as far as we're concerned, this is normal.
Yes.
If that changes, we will adjust.
I'm just getting 5-star treatment, hey?
You are getting the best treatment because you're the best.
Yes, thank you.
You deserve to have the best treatment. Does this all make sense to you?
Yes.
Okay. So I'm not going to make you sit here and wait for your creatinine blood work to come back because it's obviously being tied up in the lab.
And I'm assuming you're just going to call me if there's
I will call you if there's some problem.
Like, don't even bother if it's like, okay, I'm not even bothered.
Perfect.
Okay.
I have already sent to my lovely clerk, Grace, out here, some more appointments for you.
Great.
So you'll come back and see me in 3 weeks and we'll do this all over again prior to your next cycle.
Awesome.
And you can expect that you'll be hearing something from my x-ray department to set up an appointment for the MRI based on when we can do it here. I'm going to guess that it's not going to be right away.
Yeah.
Just because MRIs are tough to get.
Yeah.
But just to know that that will be coming. And again, I don't think it's urgent that we get an MRI tomorrow.
No.
I don't think so.
Because there's other people that are in more need.
And this does not have hallmark signs that say this is bad news.
Yes.
This is a let's be thorough.
Yes.
Okay?
Okay.
And you get the difference between that, right?
Yes, I do.
Good.
I do.
Good. All right. Any other questions from you?
I don't think so. So there you guys have it. I hope this is going to help somebody along the way, and I hope this is a big advocate for early detection of stuff like this, and how going for your mammograms and your ultrasounds are so important. So I feel very blessed and very lucky right now, and obviously I need to go and have that MRI done, obviously, but I feel so happy. So I hope that helps. I hope I've helped somebody out there. Stay positive, stay happy, and follow me with the chemo.